Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Then I do have computer glasses. It's just in the other room. As John may be co-host, I gotta admit people in. Maybe he'll do
it. Be nice, Carol.
Okay.
Okay, John, let's start the day off by you telling us how you're doing.
Who? Me?
John Tatum, yeah. Oh, that's right. So many Johns.
Yeah, John Tatum is doing just fine. I'm gonna have some physical therapy this morning at 11, and they're gonna put some heating probes in my back and give me a little bit of relief that way. But my pain in my legs is just about gone. I attribute it to regular doses of pregabalin, and that's nerve medicine. And sometimes they call it Lyrica. Let Betty in, somebody. And so, yeah, I'm doing fine, and I'm gonna have therapy.
I don't see her.
She's in.
She's in. Okay.
So therapy at 11, and my legs are doing good. We're gonna work on my back now, and the pain is going away slowly but surely.
Great. Sounds good.
News. Good news.
Yeah, good progress report.
Yeah.
Thanks be to God and your doctors, huh?
Yeah.
Good. Yes.
Okay, John, you want to start things? It was an interesting news report on the value of 2,000 steps a day versus 1,000, suggesting that if you do 2,000 steps, you live longer. So anyway, you find so many articles on so many things. It's interesting.
Why they keep bumping it up?
It's not me. That's what the article says.
Just when I thought I had arrived.
Well, you can go even further. So this is an interesting article that talks about what we talked about last week relative to the logistics of death and how the apps we talked about last week can be helpful in the steps that you take after a loved one dies. And often the grief is so much that it's difficult to remember what you need to do. And this article spells out the ones we talked about last week: cake, lantern, and empathy. And it's good to have when you have somebody die and you're not sure what the next steps are. And as we discussed last week, many of us have been through these steps. Many of you have been through these steps and recognize that dealing with death is more than a notion, and grieving is forever. So this just talks about the way in which these apps can minimize your grieving process, because they make it easier for you to address the things which must be done after somebody dies, because there's certain things that have to be done. Any comments about this article, which we discussed last week, but this is a great opportunity for you to actually see the app and decide if you want to look at it yourself and be even more ready for what is going to happen to all of us.
So, Dr. Callender, I have a friend whose mother died in 2012 or 2011. And every time he's before everybody, he's always talking about the grief of his mother. And it's so much that people are beginning to they have already, the first time you mention his name, the first thing they'll say, his mother. And, he's smiling, but he's going through the grief, but he's making other people even dread being around him because he's always talking about his mother. the thing to help him, could I just refer this article to him, or would that be an insult?
Well, I think this article is too late for him. I think grieving is a separate issue, which requires intervention by grief counselors. And that's more what he may need. And it's interesting that you mentioned that, because there's an article in the newspaper last week which talked about the fact that they now have a diagnosis for those people who still are grieving as if it were yesterday, 10 years after their loved one has died. They have a new definition and a new diagnosis for those people who are still grieving 10 years ago or yesterday. But I don't think these apps would help him. I think he needs therapy, grief counseling, and psychiatric or psychological help. And as we all do when we agree, it's something that happens, but it's also something that we are very well prepared to deal with, especially with somebody who we rely on for everything all our lives, especially in this case, his mother.
Excuse me, Doc. Someone's on with a lot of background noise. If you can mute, especially if you're outside, you can mute your mic. Thanks. Okay.
Yeah. So those are my thoughts on that. They need grief counseling, and sooner they get it, the better. But that's something that when you lose a parent, the parent is there for you for all of your life, and even after they're gone. So.
This person has lost jobs. He's a musician, and because of choirs that he directs and everything, we know the first thing that's going to come out. And he's smiling, he's just relating, almost like bragging that he had a mother. But people, after a while, they just get tired of hearing about it, and they don't know how to tell him, so they just relinquish. His name is equated with him talking about his mother. So.
Yeah, well, I think somebody could mention to him that they are grief therapists, and that he might begin taking advantage of that.
Oh, okay.
Yeah. I thought I'd include this because, as you know, Dr. Dunstan has talked about cell genomics, and maybe it's a good time to have her come back to talk to us a bit about genomics, because this year's winner of the Nobel Prize in Physiology and Medicine, and this is something looking at the genomics of extinct human beings, and this ability to extract mitochondrial DNA. Those who saw the movie that talks about how they developed those dinosaurs from mitochondrial DNA extractions would see that this is an interesting aspect. Now, as you all know, the human genome was actually finally identified and recognized in 2001, and actually completely last year. But this is the kind of work that brings to mind that the key to life is in the cells and in the cell nucleus, and the DNA and RNA and the genomic makeup is where perhaps the Lord speaks to us first. So anyway, I think this is something to be aware of. It also pointed out that 12 of the Nobel Prizes in physiology have gone to Bruin. Anyway, any comments about this? Dr. Dunstan hasn't talked to us in a while, and maybe it's time for her to come back talk to
Yeah.
us about the soul genome and
Just
our
just
organization.
backing up that slide a little bit. It was talking about the mixing of Homo sapiens and Neanderthals,
Right.
and the first migrations out of Africa. Of course, all human beings started in Africa. Then they
Right.
migrated out of Africa to other continents 40,000 years ago.
Yeah.
And the Neanderthals were already present in Europe 40,000 years ago, and they did mix for 5,000 years. And in 35,000 years ago, the Neanderthals went suddenly extinct. So, for whatever reasons, um, you know, like over a brief period of time after the mixing between Homo sapiens and Neanderthals, they were erased from the planet.
Well, I think it's interesting to know about our history, although, we talk about making discoveries of thousands of years ago and millions of years ago. And so when you talk about the creator of the world, and you're talking about the creator is obviously millions of years old and does not have the limitations of our physical bodies. When I say he's a spirit, and those that worship him must worship him in spirit as well. So anyway, I think this is, as we look outside, we have to look into ourselves, because that's where many of the mysteries lie. And that's where perhaps the voice of God is. So one of the places where the voice of God is. So regular physical activity may confer protection against adverse COVID outcomes. There's a number of articles recently that talked about after you get over COVID, that probably for 7 to 10 days is a good idea to slowly resume physical activity, because it's difficult. And this then shows that some people really had continued their moderate intensity exercise throughout the COVID process. And this study identifies that they seem to do better than those people who didn't exercise. What that means is interesting, because I'm not sure what it means. But they're saying that exercising while you have COVID is beneficial. But I think they need a lot more numbers to come to any real definitive conclusions. But that's the take-home message, that exercising, even though you have COVID, is healthy. This is an interesting article which follows up to what Sullivan and his group started with, identifying what's in what you eat. And this then, of course, is what they will then label, if you have the right ingredients, as healthy, which is, that's saying a lot, because that means that you'll have, on the word, in some foods you'll have healthy. And that is gonna be something that be a lot of competition for, which is good, because I think that the more we know about what we eat, the better off we are. It's going to be interesting to see what they define as healthy. And what they're saying is that they will call healthy that which is associated with not too much sodium, not too much cholesterol, and those kinds of things. And I think that's moving in the right direction, especially since we are, as Darryl has said many times, we're a country that is, the majority of us are obese. And so for that reason, this is an important move, theoretically, put us back on the right track. But you can lead the horse to the water, but you can't make him drink. So it's gonna be interesting to see what happens as a consequence of this. Now, when they're going to actually start that, and for us to first witness it, it's going to be interesting because I wonder how the TV ads will be when they have foods that aren't healthy that they spend most of the time advertising about. And of course, the hidden sugar consumption and the fact that sugar's in everything is also something that's going to be interesting to witness and observe what actually is called healthy food. Any comments about this? Any thoughts about the designation of healthy food?
Dr. Callender, I noticed that all the food that they give me up here in the rehab, there's no salt, none at all. They don't give me any salt of any kind. Well, they do have Mrs. Dash. You know, Mrs. Dash kind of is nice to put on foods that you used to put salt on. But yeah, and all the sugar that they give me is the, the diet sugar.
Salt substitute.
Yeah, sugar substitutes, but
Yeah.
no salt at all.
I meant sugar substitute. Right.
Yeah, sugar substitutes. Yeah.
And the appropriate emphasis on eating a plant-based diet. This is great. This is an interesting article about rice that is of interest. It's interesting how everything that's black or brown is probably healthy and that which is white is less healthy. But and so how brown rice is better than white rice, but white rice is also good. But it's just that some of the nutritional elements of rice have been eliminated with white rice that were there with brown rice. But white rice is still good for you. It's just that brown rice is better. And it talks about the health benefits of brown rice. And this is here it shows a picture of the brown rice. It talks about refined and process, which eliminates the brown outer covering. It contains more calories, but not, and more fiber, fat, and protein. Vitamin B as well. They're saying that not that anything's wrong with white rice, it's just that brown rice is better. They're different, but better.
I just noticed that the pictures we've seen so far are Chinese rice paddy, East Indian, white people, completely ignoring the rice comes from Africa.
Do any of you not eat rice? Okay.
Where in Africa does it come from? What
I
country?
don't know.
That's
Do
a
a Google
large
search.
continent.
Huh? I thought in that, well, okay, what's couscous? There's something that's called couscous or couscous something, C-O-U-S. Anybody knows what I'm talking about?
I've heard about that before, but I really don't
Yeah.
know. Yes, I've heard about couscous.
I think it's chickpeas.
Okay. Is it related to rice?
No, it's a different animal.
I know people in the islands or some African countries I heard eat couscous.
It's more like Arabic Arabic food, maybe Indian food as well.
Yeah, Google says couscous is a traditional Berber dish of seminola granules of durum wheat. It's a staple food throughout North African cuisines of Morocco, Algeria, Tunisia, Mauritania, and Libya. So it's a wheat, it's not a rice.
Oh, okay.
Okay. Talking about rice, we have two varieties of rice that I'm familiar with: brown rice and white rice. In terms of nutritional value, which one is better?
Well, that's what this article is all about.
Yes.
It says that the brown rice is better.
Okay.
That's what this article is all about.
Okay. Okay.
Yeah.
The
Brown
darker the
rice.
rice, the
And then
darker the
brown
rice, the more.
brown
better.
rice is healthier than
Okay.
white rice. Although
Yeah.
white rice is okay, but it's just that it doesn't have as many nutritive elements as brown rice.
Okay. Mm.
Yeah, to make
That's
it
what
white,
this
you have
article-
to basically remove the husk, and so
Right.
the whiter it is, the more of the husk that's removed, and the darker it
Okay.
is, the more fiber that it
I
has. And so
see.
you can even
I
have
see.
black rice. You can have wild rice. Wild
Yeah.
rice is typically blacker, but it's not totally black.
Okay. But I don't like the taste of brown rice.
Well, that's what the article starts off talking about. Some people don't like the brown rice, but it's the healthier.
Okay.
I prefer the brown rice, frankly.
Okay. Thank you.
Right.
I've learned something.
Taste is something that you can't rely on because
Yeah. Yeah.
you eat something for 21 days and all of a sudden what didn't taste good now tastes okay because you
Yeah.
become accustomed to it.
Yes.
Uh,
Yes.
yeah, for rice, people do a lot of things like they add sugar, salt to make it taste better. But one
Yes.
easy thing to make rice, wild rice and black rice taste great is add some raisins. Add a little bit of raisins to it and it'll taste great.
So I have a question. You add raisins to it, like after it's done or while it's cooking? Good morning first.
Repeat your question, please.
Let me turn my volume up. Do you add the raisins to the, I say good morning first. Do you add the raisins to the rice while it's cooking or after it's already done?
After it's already done.
Okay. Because I'm with the other guy. I don't like to taste the brown rice. I try to do it with like broth and stuff, but it just
You don't have to add a lot of raisins. A little goes a long way. And try to get unsweetened organic raisins.
Okay.
And
Or
you
if
can
you're getting raisins where they add sugar, well, then you're just compounding your sugar problem.
Okay. Thank you.
you can also add tomatoes.
They asked the question, what is the largest organ in the body?
The skin.
Without question, right? The skin, yeah. And for a while, people didn't recognize that the skin was the largest organ, but it's without question the largest organ. And of course, it's external, and of course, it protects you. It's the first line of protection in some ways, because some would argue that the GI tract is also an important organ of protection. Top 5 largest organs: skin, the liver, lungs, heart, and then the kidneys.
So the definition of an organ is a group of tissues that work together.
Sure.
Right. The liver has Those people who had liver disease know that filters that toxins out of your body. Similarly to the way the kidney does, but it's just more, it does more, it's the largest, second largest organ in the body. And it is involved in so much metabolism. 79 generally recognized organs in the body. The strongest muscle in the body is the masseter, which is the muscles that are responsible for chewing. If you use all the largest muscle in the body is the butt, gluteus maximus.
On the butt.
Yeah. Largest bone in the body is the thigh bone, right?
Mhm.
Google says the brain is an organ, so why isn't it in the top 5?
I don't know.
Not that big.
That's pretty big. It's almost as big as the liver.
Yeah, it says average brain weighs between 1 and 3 pounds.
I don't know why it's not the top 5. That's a good question. And these are the blood types that we all know about. And what is the most common type? That's what. And of course, we talked about the Red Cross. A positive is top. That's what. And a lot of us are B, especially blacks are Bs, but A positive is the commonest type. And the AB negative is probably the least common type. And we talked about veins. We had Dr. Ivy talk about veins. We haven't talked much about the arteries, which are the source of nutrition for the rest of the body. And the aorta is the largest largest artery coming out of the.
Michael Stevenson.
The beta cells of the pancreas, responsible for insulin production. And that's the cell, if we could reproduce it, would eliminate some of the type 1 diabetes and type 2 diabetes, the beta cells. So we had stem cells that did that to eliminate diabetes.
All right, go ahead. I'll look at you.
These are the, it's interesting, what organ can you live without? You can live without one kidney. See, it says kidneys because you were born with 2. So you can live without one kidney, you can live without one lung. We talked about uterus transplants. Talks about the organs that you could live without if you had to. Because we've had examples of everything. And living without a gallbladder is probably the easiest. Spleen is probably not, because if you take out the appendix, you don't really lose much. You take out the spleen, you do have to replace, you have to use certain medications to take care of, otherwise you die from infection. So spleen is not an organ that you can just take out without doing something else. I'm not sure I'd put that up there. Gallbladder, you don't need it at all. Appendix, you don't need it at all.
What's the function of the spleen?
Spleen is involved with antibody production. And so if you don't have a spleen, we have to give you some antibodies to keep you from developing pneumonia. And so that's why I don't agree with that's having the spleen up there, implying that you can live without the spleen,
Right.
which is not accurate.
Mhm. Okay, thank you.
Dr. Callender, this one about the
Pineal gland.
pineal gland, right?
Well, it's of course the smallest organ in the body, but it's an important one. And we don't talk much about it, but it releases melatonin. And of course, hear a lot about melatonin. Don't hear much about the pineal gland.
Isn't it the source of melanin also?
Melatonin.
I know, but also in addition to that, isn't it the source of melanin?
Not as far as I know, but you could look it up. I don't think so.
All righty.
Do you have to do something different, like with the gallbladder? If you don't have a gallbladder, is this anything?
You don't need a gallbladder.
You don't need a gallbladder.
No, we do cholecystectomies all the time, and the patients do quite well without it.
Okay.
Similarly, with the appendix, you take that out, you don't have any problems.
I saw stomach on the list. You can live without your stomach?
Yes, you can, because we have done gastrectomies and replaced the stomach with the small intestine. Yeah. Now, you may argue that you can't hold as much food there, and that's correct, but you can live with that. That's the point. Yeah. You can live without your eyes, won't be able to see, but you still live without them. Yeah. So. Now, this is an article I put in because there's so many people with type 1 and type 2 diabetes. And the biggest trouble with type 1 diabetes is I have one of my patients who.
Just hold on. I'm still on the phone. I'm still on the line with you. Okay.
I'm
gonna wait. Come on. I'm gonna wait. Come on.
Okay.
Can you mute, Dr. Hey, John, can you mute? Yeah. Okay. Yeah. The thing about type 1 diabetes is that you have no insulin. Type 2 diabetes, you have insulin, but it's not functioning well.
Yes. Yeah. Click. Yeah. Yes. Got it.
Yeah. So with bionic pancreas, this is something where the system will automatically.
Good. So just listen to what's going on now, all right?
Well,
I'm just gonna listen to what's going on now.
Please,
I can see your name.
Okay.
can see your name, participant.
Yeah.
Okay, good.
Michael Stevenson, could you go on mute? Yeah, please.
No, but should I want to go ahead and listen to what
Could you go on mute, please?
Sure.
Go on.
Even if you with the participants list, you can still be listening.
Okay.
You can
Can you put them on mute so we can go? Okay, thank you. So this then would automatically take care of the insulin of the glucose level without you having to do anything about it. And this is this new, which is not available yet. It has not been FDA approved, but it's something that down the road will take all of the mystique out of diabetes. And it's hopeful that this will occur sometime in the very near future. But it's not available yet. And the type 1 form is the form that you see people very young and often under the age of 10. But you also have it in adults who are under the age of 40. And this is it's associated with requiring a large amounts of insulin. I have one patient who required over 100 units of insulin and still was not controlled. And actually was never controlled until she had bypass surgery, bariatric surgery. After bariatric surgery, she required no insulin. But this, for people who are overweight, bariatric surgery can eliminate the diabetes for many, not everyone. many. But so those who are diabetics, they often have to do frequent finger sticks, or in some is continuous glucose monitors. And so this computer that is going to monitor glucose readings and automatically adjust the insulin dose is something that will make life easier for most type 1 diabetics. And for type 2, many of them, type 2 diabetics, can control it by losing weight and exercise, as well as taking other medications. Now, this is has been tested, and they found that the bionic pancreas worked and allowed people to have a relatively normal hemoglobin A1C, which is the way you measure the blood sugar over a long period of time, so that the best way to follow glucose level is with a hemoglobin A1C, which gives you a measure of the average blood sugar level over the past 3 months. And of course, the normal is actually less than 6. But there are many diabetics who have hemoglobin A1Cs that are above 10. And of course, that's dangerous. And we know that diabetes is associated with arteriosclerosis and many other complications that are related to the high level of glucose and the requirement of insulin production, hyperinsulinism as well. So that for type 1 diabetes, there's a hope down the line that you won't need necessarily a pancreas transplant, but maybe a bionic pancreas.
So, Dr. Callender, even if they have this machine, they're still going to need insulin, though, right?
Yeah. This just combines. This releases insulin.
Okay.
It releases insulin, and so it just does it automatically.
Okay, so they don't have to test themselves. They don't have to
Right.
take blood.
They have a machine inside that does it, and it also releases insulin to get the blood sugar down. Of course, you notice that the hemoglobin A1C that they talked about was 7.3, whereas the hemoglobin A1C that you really need to have is less than 6. So, yeah, and that's the ideal, is in the 6 to 7 range. But of course, below 6 is the normal range. 5.9 and above is diabetes.
Okay, so how will the insulin get in them? Do they, with this machine inside, do they still have to inject themselves?
No, the machine does it itself.
Wow.
Machine will release pancreas. will release insulin.
So how do you get the insulin into the machine?
That's why they call it a bionic pancreas, because it has insulin in it, and so you won't have to do anything. Your bionic pancreas, when the blood sugar gets above a certain level, insulin will be released by this bionic pancreas. So you have to do nothing. The bionic pancreas will do everything.
Oh, okay, maybe I'm misunderstanding.
It's a pancreas, just like a pancreas, but it's just a mechanical pancreas.
Well, how does it get the insulin?
Insulin is already there. That's part of the machine. It's just a machine that releases insulin. It's a machine. Just what the pancreas does is the beta cells release insulin.
Okay.
This machine releases insulin. So it's an automated insulin therapy, automatic. So it is not. In other words, this is a automatic bionic pancreas that releases pancreas when necessary.
So it's designed to work just like your pancreas.
That's correct.
And so does it manufacture insulin? It's
Yes.
inside you, right?
That's
Yes.
really my question.
So
It
it
manufactures.
manufactures it.
Okay.
Yes.
Okay. Very good.
Wow.
Yeah, I kind of thought that's what John was trying to get to. How did the insulin get there?
Yes, it's in the machine, right?
Okay. That's tight.
It's good, but it's not as good as the beta cells. And it's not as good as a pancreas transplant, but it doesn't have the side effect of the pancreas transplant, because in order to get a pancreas transplant, you need to be on immunosuppression, which has its own problems.
Mm.
So
Dr. Callender, how is this different? My daughter is diabetic one. She has an insulin pump. How is this one different?
what is different is that an insulin pump also responds, but it's just not perfect in its responses. It doesn't accomplish the job of keeping the hemoglobin A1C less than 7. And so this is an advance over the insulin pump. If you have an insulin pump that actually keeps you at a hemoglobin A1C of less than 7, then this bionic pancreas is probably not for you. But if you have a insulin pump that you have trouble, as some patients have, of keeping your hemoglobin A1C less than 7, then of course this would be something that you'd be interested in. But the insulin pump does what you're talking about. It's just that it doesn't do it as well as this does.
Does it attach to the body the
Neither of
same
them-
way an insulin pump?
Neither one of them do as well as the pancreas.
Oh, okay.
That's fine.
So a transplant is better?
Yes, it's better, but you also have to take immunosuppression. That's the problem with the pancreas transplant. So we talked some time ago about a new development that they had an ability to do coat the pancreas so that you didn't need immunosuppressant. So when you get to the point where you have a pancreas that doesn't require immunosuppression, that would be the ideal. Because the immunosuppressive medications make you more susceptible to infection and other complications. Whereas if you had a pancreas that did not require immunosuppression, that would be the best of all worlds. Or if you had stem cell transplant with beta cells that didn't require immunosuppression, that would be the best of all worlds.
And all of these are for type 1 diabetes, right?
Yes, because type 2 is much easier to control than type 1. Type 1 is also not only associated with the highs of high blood sugar, but the lows. And the hypoglycemia, which is a low blood sugar, can kill you just as well as having a high blood sugar. And many of the type 1 diabetics die from hypoglycemia, which is the blood sugar gets too low and the brain dies. And so that's the complexity of having diabetes. So if you have somebody who's has diabetes and their blood sugars are easily controlled, they are in a way blessed. Whereas a number of people, in spite of insulin pumps, in spite of other things, they still have hemoglobin A1Cs that are higher than 9. And so those people need something else. And this may well be the something else if they can't get a pancreas transplant. And because of the side effects of the immunosuppression, this becomes an option. Sorry, it's so complex and difficult for me to make it clear to you, but this then is what we're talking about.
Okay.
Here again, though, it's not FDA approved yet. So So we'll have to wait for that to occur first. But anyway, there's light at the end of the tunnel. Just if we can be patient and wait for it. Diabetes is so common, I thought it was worthy of discussing.
This is the beginning of a bionic person. Huh?
It's already begun. Not the beginning. It's another step towards the bionic person. We talked about this last week, but this takes it a step further. Last week we talked about the fact that coffee improves your cardiovascular profile and decrease the likelihood of cardiovascular disease. Now we've gone a step further. Say 2 or 3 cups of coffee gives you a longer lifespan, as well as a lower risk of cardiovascular disease. So you coffee drinkers can take comfort in the merits of coffee.
Thank you.
Tea drinkers may have the same thing. Tea drinkers, black tea especially. Yeah. So
That's just what I was going to ask. You get an article about tea.
right, there are articles already. They have many articles about black tea already that we've discussed in the past. Right.
Is that with caffeine or without caffeine?
Tea has caffeine.
I know the coffee.
Oh, it doesn't matter. That was interesting. They talk about ground isn't and decaffeinated. Should be considered part of a healthy life. So both. All 3. Amazing. So those who can't take the caffeine can get decaffeinated coffee and have the same good consequence. And the numbers are pretty impressive, although they don't tell you the nature of the participants, in terms of the ethnic makeup, etc. Well, you know, America's a nation of coffee addicts, so it helps that the addiction is not lethal. It's interesting in this study, the ground and instant coffee had the greatest reduction in arrhythmia. Interesting, the decaffeinated, that was not true of the decaffeinated, right? So the caffeine apparently is good for you. Interesting. Heart healthy behavior. Can you imagine that? How about that? First, 1 to 2 drinks of alcohol, and now coffee.
You know, part of the issue though comes with if you just drink black coffee, that might be the case, but I don't ever drink black coffee, you know. So I'm putting sugar. I used to have sugar in it. Now I put honey in it, but creamer and half and half, you know, those are things that might make the coffee not as healthy, but the coffee substance does still help with the health.
Yeah, interesting. Okay. This is very timely because it is flu vaccine time. And this is a reminder that if you're over 65, you need the special. So don't go to the drugstore and just take any old flu vaccine. You need the revved up shots for seniors, and you have to ask for it because they may not give it to you without asking for it. So let them know your age, let them know you're over 65, and your immune system requires special dose. And this talks, as you go down, talks about the kind of shot you need to ask for. And then Fluzone, high dose, Flublok, Fluad adjuvanted. But once you tell them that you over 65 and that you need a high dose vaccine, they'll understand. But don't just go and take anybody's flu vaccine. If you're over 65, you have to get the double dose. They're quadrivalent. But the younger people don't need the extra boost that we older folks need. Now, the reason this becomes an issue is because in Australia, they just had the worst flu season in 5 years. And what happens in the Southern Hemisphere often foreshadows what happens in the North. So as people have abandoned masking and distancing, it's likely that the flu this year will be worse, they say. So we can keep that in mind, get the double dose, and keep wearing your masks. And remember that the issue, just as with the COVID vaccine, is that those people who had the vaccine still may get the flu, but they are unlikely to require hospitalization or death. And that's the reason why the flu vaccine is recommended, just as why the COVID vaccine was recommended, to decrease the likelihood of hospitalization and death. Any comments or question about this? And now is the time to get the flu vaccine, because it's October and the flu season starts in November, December, January, and February.
So, Doc, suppose if you're 62.
John Buchanan, you 62.
Yeah, at 62.
72.
If I were 62 and I'm 85, so, but if I were 62, I'd probably want to get the version for the 65 olders. But you don't have to. It's optional. At 62, it's optional.
Dr. Callender, I've heard a lot of people, and some in the medical field said they didn't get the flu shot because they get the flu they didn't want the flu because it gave them the flu. Do people really know that you can get the flu even with the flu shot, but it's less severe?
Well, I don't understand your question, because you can't get the flu from the flu shot. Cannot get the flu because it's not a live virus.
Right, but I've heard people say that.
I've heard them say it too.
They tend to believe it.
That's true. You're right.
And I've heard some medical people say that.
Well, all medical people aren't the same.
Oh, okay.
I've heard people say, I've heard many people say what you said, but it's not likely.
Oh, okay.
Yeah, I will always get the flu shot. Last time I had the flu, it was miserable. I was dizzy, couldn't stand up. And that was like over 20 years ago. No, probably 30 years ago. I've been getting the flu shot every year since then. It is miserable. Fever. I mean, you know.
Don't forget, as Darryl had identified, that it's about 6,000 deaths per year from the flu. So it's a lethal infection if it's. Now, of course, and here's the thing, we have medications for the flu. So if you catch it in time, it can be treated. But if not caught in time, then it can be lethal.
But Doc, those medications though, they don't kill the flu. They just work on the symptoms, right?
No, they kill the flu.
Oh, okay.
We have antiviral medications that kill the flu.
Oh, I didn't know that.
Yes.
Okay.
Yeah. Matter of fact, in 2019, I was in the hospital and they gave me that anti-flu medicine. I was there overnight. Oh, that's right. I was in group in the morning, had a mask on.
I remember that.
Yeah. And then that night, I wound up in the hospital, temperature 104. That's right. And they gave me the anti-flu medication, and that took care of it. Yeah.
Wow. So they're talking about using the mRNA technology now.
Absolutely, yes. And that's the thing that may make a difference. It'd be interesting to see. Now, this is something that just happened September, that universal masking is no longer recommended in healthcare facilities, so that they do not require doctors, patients, or visitors to wear masks in the hospital. Of course, our hospital hasn't complied, but they've relaxed it so that you don't. It's not mandatory, although you got to wait for the hospital. That just happened September 30th, so this is just the first week in October. So it's going to be interesting to see how the hospitals react to what CDC has said. And I think a lot of this happened after you had the bivalent vaccine available. But what is interesting is that seems like about 5% of those people who are eligible to take the COVID vaccine are actually taking it. And when you go into public gatherings, it still seems like it's advantageous to wear a mask, although they don't require it. This is the difference. If you want to wear a mask, you can, but it's not required.
Doc, do you think it's safe to go into a restaurant and eat nowadays?
Yeah, I think so. I think if you can eat outdoors, better, but I think nowadays it seems like it's safe. So the rates of hospitalization and infection are less in the area we live in. And so it seems to be safe. Yeah. The more crowded it is, probably the less safe it is. Now this is great because CDC drops travel and health notices for individual countries, which is all suggesting that the pandemic is nearly over. If only the hospitalization rates and the new infection rates would go down as well, then I'd be happier. But until that happens, I'm still not agreeing that the pandemic is over. But anyway, the ability to travel has become less complicated. Regional and national travel was already bad, but international travel was nearly, you really had to really want to travel to do it. Many people did it though. And of course, there are many countries up until September 30th who barred people from coming to the country if they weren't vaccinated. This no longer applies to most people.
Alrighty.
One thing goes away, another thing comes. And so cholera, which is got a high fatality rate, is occurring in some countries that are in some developing countries where there's contaminated food or water. And of course, the fatality rate is tripled. 3% in Africa. Cholera can kill within hours if untreated.
Mm.
And what happens, you get so dehydrated that your blood pressure drops and you just die. Africa, Asia, Pakistan. And of course, the flooding has led to some of this. then the cholera vaccine is available, but you have to get it. And we recognize as a consequence of COVID that there is inequitable allocation of vaccines as well as resources, but especially vaccines. And so the developing countries don't always have enough vaccines. And this is something. The World Health Organization maintains an emergency stockpile. You just have to get it.
Have you heard anything more about polio?
So far, that although it has been reported in countries outside the United States, I haven't heard anything new from what we discussed last week relative to the finding of polio in the water. I haven't heard anything new since then.
Okay, that's all the articles.
All right. Let's see. We have a new visitor today, right?
Yes, that's my my colleague and a Howardite.